Emily Miller, a senior opinion editor for the Washington Times. Chris Kofinas is a Democratic strategist. Welcome to both of you.
Thanks.
Chris Kofinas, let me begin with you because, I mean, how bad is it for the White House now that they are starting to roll back the president's pledge that we heard over and over and over that everyone who likes their health insurance gets to keep it?
Well, I mean, it's not good. I mean, anytime you're in a situation where you have to kind of walk back what you had said earlier, that creates a bit of a problem. I think what makes this even more challenging is that you're dealing with the kind of signature, policy and piece of legislation for the president. I mean, I think that the challenge for the White House, I think, and this is always difficult when you're in these positions, is to kind of admit to the reality, as difficult as it is, and as political the Republicans are going to try to make it no matter what you do. They have got to come out and basically state the facts. That it was a misstatement. He needed to be clear. He can apologize and move on and focus on the good things that are in Obamacare that are going to improve people's lives. But the more that you kind of, play this song and dance around the edges, the more you kind of give fodder to the Republicans to kind of keep beating you, and the more you create a problem with the American people.
Well, with Republicans, Emily Miller, I mean, how do Republicans play this politically? Do you think there'll be more calls to delay parts of the program?
Yes, I do think they'll keep pushing to delay a year for the individual mandate. But, what you're seeing from the Republican side of the aisle is almost silence, because everything that's happening is happening without them pushing it. This is not a political agenda. I mean, millions of Americans are just getting letters in the mail saying your insurance has been canceled. The next option is double the price or 20% more of the price. And it's reality. And,
so do you think they regret the shutdown strategy? I mean, this could have been the headline weeks ago.
I don't think so, because the shutdown always started with Ted Cruz saying we need to stop Obamacare in its tracks. So it was always based on the fact that Republicans have predicted exactly this debacle of coming up. And, the reality is so bad. And I don't know if people are going to remember the shutdown in a year, but they're going to remember when they look down and get their monthly bill for their health insurance and see it's 20, 30, 40% more than they paid last year, and they didn't want this new plan. That is what's going to make a difference in 2014.
I think Democrats would dispute that, as it's written in the history books, but I want to move on. Chris, one of the top officials in charge of implementing Obamacare got another earful today on Capitol Hill, and this time it is Republicans and it's Democrats. Take a look.
I believe that there's been a crisis of confidence created in the dysfunctional nature of the website, the canceling of policies, and sticker shock from some people.
After nearly $400 million, healthcare.gov is synonymous now with failure. The public's trust has been broken, and the reports I'm hearing reinforces why.
I think it's very confusing. I know my time is up, but I think it's very confusing about where you go. We hear about the navigators and the this and that, but I can tell you, people really don't know.
Chris, loss of confidence, loss of trust. How does the president get those back?
I mean, I think you've got to be very clear to the American people about the problems. You got to be very transparent about where things are, how you're going to fix the things that are clearly broken. And listen, when you have Democrats like Senator Mikulski, hitting you as hard in some cases Republicans, you've got a serious issue. The one thing I will say, and this is a kind of an important point to keep in mind, the Republicans are being ridiculously hypocritical about this. Yes, there are problems with Obamacare. Yes, there are people that are, losing their health care because of the change of the plan in order to meet the ACA requirements. But I didn't hear a peep from Republicans when these problems were happening across the board to countless of Americans for years. So yes, there are challenges here, but I always you really kind of see the reality of where the Republicans' position is and what their policies are. When they don't offer solutions, they're really good at criticisms.
Go ahead, Emily. Respond.
Chris, no one was getting letters in the mail for years saying that their insurance had been canceled and it was doubling. That's absolutely not true.
That's factually incorrect.
No, okay, who are all those people then, Chris? Where are you hearing those people? Because no one else seems to know them except for you, Chris. But
do you actually believe?
Go ahead, Emily.
What Brooke is really talking about is the integrity of the presidency, and that's the bigger issue. That's why you see his poll numbers at 39%, because what does the president have but his word? It's not that he made a mistake and said, if you like your plan, you'll keep it. If you like your doctor, you'll keep it. We now know that going back to 2010, HHS predicted that 80% of people, up to 80% of people who have their own insurance plans would lose it because of these new mandates and there's new requirements that HHS has put in that you have to have things like maternity care, prescription care, hospitalization. So the White House knew this and continued through the 2012 election to get reelected to say, if you want to keep your insurance, you can. And that is where the American public has really lost trust in this president.
Chris, respond. We got to go.
Yeah, I mean, listen, I think there's just two key points or two distinctions. One, the president and the administration clearly have to face up to that there were things that were said that weren't correct, that weren't, I think, as accurate or as direct as they needed to be. That, I think, is something the president and the administration could do. But let's not ignore the fact that Republicans offer no alternatives, no solutions that will address the fundamental problems that the Obamacare Act actually does. And that, I think, is a big distinction here.
All right, guys. Emily Miller and Chris Kofinas, thank you both very much. Thanks.